Bismillahirrahmanirrahim. Assalamu alaikum, dear viewers. Today our topic of presentation is pharmacology, differentiation about drug and medicine, categories of drugs, and classes of drugs. So first of all, I will define pharmacology. What is pharmacology? Pharmacology is the branch of science which deals with the study of drugs. Now, difference between drug and medicine. Drug, the chemical or natural substances capable of being used for therapeutic purposes, which also include narcotics. ड्रग एक ब्रॉड कैटेगरी है। इसमें वो केमिकल या कुदरती चीज़ें आती है जो ये सलाहियत रखते हो कि ये इलाज के लिए इस्तेमाल हो, इसे हम ड्रग कहते हैं। लेकिन इसके साथ साथ ड्रग जो है ये इलाज के अलावा रिक्रिएशनल पर्पसेस के लिए नशे के तौर पर भी इस्तेमाल होते हैं, तो इसे हम ड्रग कहते हैं। इसके मुकाबले में मेडिसिन आर दोज ड्रग्स यूज फॉर थेराप्यूटिक पर्पसेस। मेडिसिन वो अद्वियात है जो सिर्फ और सिर्फ इलाज के लिए इस्तेमाल होते हो, उसको हम मेडिसिन कहते हैं। तो इसका मतलब ये है कि ड्रग जो है ये एक ब्रॉड टर्म है और मेडिसिन जो है ये एक स्मॉल टर्म है। इन शॉर्ट अगर हम ये कहें ऑल मेडिसिन्स आर ड्रग्स बट नॉट ऑल ड्रग्स आर मेडिसिन, कि सभी मेडिसिन जो है ये ड्रग्स होते हैं लेकिन सभी ड्रग्स मेडिसिन नहीं होते। नाउ आई एम कमिंग टुवर्ड द कैटेगरीज ऑफ ड्रग्स। सो ड्रग्स act on different body systems. On the basis of this, drugs are categorized. So first of all, drugs affecting the autonomic nervous system. Autonomic nervous system include enteric nervous system, parasympathetic nervous system, and sympathetic nervous system. The second category is drug affecting the central nervous system, which include brain and spinal cord. These drugs are controlled drugs. The third categories are drug affecting cardiovascular system, which means heart. The fourth category is drug affecting endocrine system. Endocrine system means hormonal systems. The fifth category is drugs affecting other disorders. Other disorder mean respiratory disorder, gastrointestinal disorder, anti-inflammatory, antipyretic, analgesic drugs, and others. Now I am coming toward each category in detail. First of all, drugs affecting central nervous system. This is the most important drugs which can act on the central nervous system, brain, and spinal cord. So in this, the first class of drugs are sedative and hypnotic drugs. Sedative and hypnotic drugs means the drugs which are used for sleeping purposes. The second class is antidepressant, the drugs which can be used to suppress the depression. The third class is antipsychotic drugs, the drugs which can relieve psychosis. The fourth category is drug for epilepsy, which can relieve epilepsy. The fifth one is anesthetics, which can be used for anesthetic purposes. The sixth one is opioids or narcotics, which can be used for pain relieving. The seventh class is drugs of abuse, which can be used for recreational purposes, cocaine, amphetamine, etc. The eighth class is CNS stimulants, which include caffeine, nicotine, amphetamine, cocaine also. The second category, drugs for other disorders, includes so many drugs, but we can discuss only important drugs. Classes of drugs. First class is drugs for respiratory disorders. The second class is drugs for gastrointestinal disorders, which also include proton pump inhibitor, H2 receptor blocker, which can be used for peptic ulcer disease. Anti-inflammatory, antipyretic, and analgesic agents, which also be called as NSAIDs. First, I will discuss about chemotherapeutic drugs or antimicrobial drugs. It is a huge categories of drugs which have so many classes, which includes antibacterials, antifungal, antiprotozoal, anthelmintic, antiviral, anti-cancer, and immunosuppressants. So first of all, I will discuss antibacterials. So antibacterials further include cell wall synthesis inhibitors, which include penicillin class, cephalosporin class. A second one is protein synthesis inhibitors, which includes aminoglycosides, macrolides, tetracycline, and chloramphenicol. Fluoroquinolones, which is also a huge class of medicines, which includes ciprofloxacin, levofloxacin, moxifloxacin, etc. The fourth one is folic acid synthesis inhibitors, which includes sulfonamides. The fifth one is antimycobacterial drugs, which is also a huge class, which include isoniazid, rifampicin, etc. These are also called antibacterials. The sixth one is antifungal drugs, which can be used for fungal infection, which include itraconazole, ketoconazole, fluconazole, etc. And the seventh one is antiprotozoal drugs, which include metronidazole, etc. The eighth one is anthelmintic drugs, which include albendazole, mebendazole, etc. Ninth one is antiviral drugs, which is also a huge class, a big class of drugs, which include remdesivir and other drugs. The 10th one is anti-cancer drugs, which is also a huge class of drugs, include so many drugs. The last one is immunosuppressant drugs. But here I can clarify one point that chemotherapeutic drugs, they are called chemotherapeutic drugs because this class include anti-cancer drugs. It is also called antimicrobial drugs because this class can be used against microbes, which can be bacteria, fungi, protozoa, virus, etc. The point is that all antibiotics are antibacterials, but not all antibacterials are antibiotics. That antibacterial is a broad category and antibiotics is a small category which can occur within the antibacterial drugs. So this is the most important category of drugs within the pharmacology. Inshallah, in coming lecture I will discuss the important drugs which commonly used in daily life. Thank you for watching. Allah Hafiz.